completion of coagulation. As we said, after you activate all the clotting factors, at the very end, what's going to happen? You're going to have thrombin. And thrombin will activate fibrin, and with that, we are going to end coagulation. I think we already repeated that a lot of times. Intrinsic factor and extrinsic factor, one thing that you should be aware of is that they need calcium in order to become activated, in order to make it work. So as you can see here, calcium is very important on that. Okay. So all these coagulating factors are going to create this process of coagulation. And as you can see here, see the different factors. And at the very end is just to create thrombin, and thrombin eventually is going to create fibrin. So the last two steps are the ones that you need to know. In coagulation, you have the clotting factors, and the clotting factors eventually are going to activate thrombin, and thrombin will create fibrin. That's about it. Now, how long does it take in order to do this? It doesn't take that long to coagulate. Maybe like from a minute to 10 minutes approximately. So as you can see here, for example, it says normally if you have bleeding of a finger stick, then you should stop in 2-3 minutes. There's something called bleeding time, which is called through the IV method. They put a blood pressure cuff, they make a deep incision, and you should stop bleeding in less than 10 minutes. So as I was telling you, it's not a long time in order for us to stop bleeding. Obviously, some of these processes, depending on how deep the cut is and what we are trying to measure, then they're going to take a little bit more time than other processes, than other procedures. But usually, again, it's something that happens very, very relatively fast. Right? It's not necessarily maybe 2 seconds, 3 seconds, as you may be aware, but it's definitely something, a process that does not take hours. Let's take a look in here at the clotting factors in table 18.7. So as you can see, you have the number of the clotting factor, the name of the clotting factor, and where they come from. So as you can see here, most of them come from the liver, but at the bottom, you're going to see the other clotting factors that, as you can see here, they come actually from platelets. Again, you don't need to know the numbers. You don't need to know the names. You just need to know, for example, this activates this one activates this other one activates this other one. And at the very end, they will activate thrombin, and thrombin is going to create fibrin. That's all you need to know regarding this sequence of coagulating factors and coagulation. So what happens with the blood clot? Then, obviously, once you create a blood clot and it's strong and it stops us from bleeding, then the area of the blood vessel that was damaged needs to get repaired. For that reason, the platelets as well as the cells in your blood vessels are going to release something called platelet-derived growth factor. As you can see here, growth factor, it comes from the platelet, so you can actually try to remember it that way. Platelet and growth factor. Why? Because they will stimulate the fibroblasts as well as the smooth muscle cells in your blood vessels to multiply and repair the damage that happened in the blood vessel. So what happens with this is that eventually you are going to repair the area that was damaged because you're going to release the platelet-derived growth factor. So once that happens, you actually have to get rid of the blood clot. The destruction of the blood clot, now that the blood vessel is repaired, is called fibrinolysis. As you can see here, fibrinolysis. So how do you destroy the blood clot? The same way that in coagulation, I told you that you need to remember the two last steps, which is thrombin and then fibrin. In order to destroy the blood clot by this process, you need to know two steps: kallikrein and plasmin. After a sequence of events, you're going to activate an enzyme called kallikrein, and then kallikrein is going to create plasmin. And plasmin is an enzyme that is going to destroy the blood clot. Once you destroy the blood clot, then obviously you're going to be able to see the area that was repaired. So if we look at the steps of destroying the blood clot, then you can see here the sequence of events, but right here you have kallikrein, and kallikrein eventually is going to create plasmin, and plasmin is the one that is going to destroy the blood clot, as you can see right here. So you need to remember kallikrein as well as plasmin. Very important. So which ones are the two last steps in coagulation? Thrombin and then fibrin. Once you have the blood clot and the blood vessel has been repaired, now you need to destroy the blood clot. What are the last steps in order to destroy the blood clot? Kallikrein and plasmin. And plasmin eventually is the enzyme that is going to destroy the blood clot. Okay, so then here says prevention of inappropriate clotting. Basically, after you produce thrombin and then you produce plasmin and coagulation starts to make the blood clot very hard, how come this does not continue? That's basically what it says in here. How the blood clotting does not continue. How come you don't create a bigger and bigger and bigger blood clot? Well, there's quite a few factors, quite a few reasons. Platelet repulsion. Obviously, the first step is to create a platelet plug. In order for you to create a platelet plug, the platelet must be attached to the damaged blood vessel. However, during the intrinsic mechanism, you don't need to have a blood vessel damage. So that means that you can create a platelet plug and initiate hemostasis. However, how do you avoid that? Because the blood vessel is very smooth, making for the platelet very hard to attach to it. In addition to that, the blood vessel is going to release prostacyclin. Prostacyclin is something that is produced, it's a substance that is produced by the blood vessel that avoids the platelet to be attached to the blood vessel. So platelets cannot be attached to the blood vessel when the blood vessel is healthy because the blood vessel is very smooth. And not only that, the blood vessel is going to create prostacyclin that repels the addition of platelets to the blood vessel. Dilution. Since, again, if we talk about the intrinsic mechanism, that means that you can create thrombin because you don't need the blood vessel to get damaged. So in normal circumstances in your body, certain amount of thrombin gets produced. But we have so much blood, and the blood flows so fast that it doesn't allow the thrombin to actually create very big blood clots. Therefore, it doesn't allow it to actually create big things, and rather the flow as well as the speed of the blood and the amount of blood makes this thrombin disappear. It dilutes the thrombin. Anticoagulants. Thrombin is the one that is going to initiate the formation of fibrin. However, we have a couple of substances called anticoagulants. There is one anticoagulant called antithrombin that is produced by the liver. Obviously, if the substance that makes the plasmin is called thrombin, then if you have a substance that is called antithrombin, then obviously it will stop the production of fibrin, therefore stopping the production of plasmin. The production of fibrin. And fibrin will not be able to produce a blood clot. Also, you also have heparin. Heparin is produced and released by the basophils. Heparin is also another anticoagulant. So these three are the mechanisms that we are going to use in order to stop blood clotting when it's not supposed to happen. And then after that, we have clotting disorders. There's multiple different kinds of clotting disorders, such as hemophilia, for example, right? Hemophilia is the lack of some of the coagulating factors. And because of that, obviously, you're not going to be able to form a blood clot, and therefore you're going to bleed. And obviously, that's a problem. When we were talking about platelet degranulation, we said that platelets are going to release serotonin, adenosine diphosphate, ADP, and thromboxane A2. Aspirin interferes with the mechanism of thromboxane A2, therefore inhibits or stops platelet aggregation. Therefore, aspirin is not going to allow a proper hemostatic mechanism. Also, the liver produces many coagulating factors. So any disease affecting the liver will affect the coagulating factors. Many clotting factors need vitamin K in order to be created. And vitamin K need bile from the gallbladder in order to get absorbed. So if you don't have vitamin K, it's because there is a problem with the liver.